How to detect prehypertension early. Are you curious about how to catch prehypertension before it becomes a bigger issue? Understanding how to detect this condition early can make a world of difference in your health. Prehypertension is when your blood pressure is higher than normal but not yet classified as hypertension. Knowing how to monitor your blood pressure is key to preventing serious health problems down the line. First, let's talk about blood pressure ranges. Normal blood pressure is below 120/80 millimeters of mercury. Prehypertension is defined as a systolic blood pressure between 120 and 139 millimeters of mercury, or a diastolic blood pressure between 80 and 89 millimeters of mercury. Hypertension is diagnosed when blood pressure reaches 140/90 millimeters of mercury or higher. Since prehypertension usually does not show any symptoms, regular blood pressure monitoring is essential. You can use a reliable blood pressure cuff that wraps around your arm. It is best to take measurements on multiple occasions. Ideally, you should measure your blood pressure during 2 or more visits to confirm consistent elevated readings. For the most accurate results, take 2 measurements each day, once in the morning and once in the evening, at least 1 minute apart. Discard the first day's readings and average the rest. Participating in screening programs can also help identify prehypertension early. These programs typically involve trained health professionals using proper equipment. They educate patients and have follow-up systems in place. Screening can help detect prehypertension early, allowing for timely lifestyle changes or medical advice. Consider your risk factors as well. Factors like age, gender, height, weight, waist circumference, pulse rate, and physical activity levels can help estimate your risk of developing prehypertension. New methods using machine learning can also predict hypertension risk based on these factors, especially in areas with limited resources. Although prehypertension does not have symptoms, it can be linked to early signs of atherosclerosis, which is the hardening of arteries. Medical evaluations can help detect these early signs. Being aware of lifestyle factors that can raise blood pressure, such as high salt intake, excessive alcohol consumption, lack of exercise, and obesity, can encourage earlier screening. If your blood pressure readings consistently fall within the prehypertension range, your healthcare provider may suggest lifestyle changes or further monitoring. The goal of early intervention is to prevent progression to hypertension and reduce the risk of cardiovascular diseases. Detecting prehypertension early relies on regular and accurate blood pressure measurements, assessing risk factors, and participating in screening programs. Since prehypertension does not present symptoms, proactive monitoring is vital to identify it before it advances to hypertension.